Good afternoon, everyone. Just before Minister addresses you, I'll just give you a brief update, and this update really is concentrating on our local situation. So I know we've been having lots of press releases, but just to give you a consolidated view on what our local situation is of now. And the information in this briefing is based on what we have is what was released in our press release of yesterday. So later on today, we'll be updating you on today's situation. So as of now, as of 21st June, we have a total of 142 confirmed cases. And this comprises 118 imported cases and 24 local cases. Now, if we look at all these 142 cases, how are the age distribution of these cases? So this table shows you how the distribution from less than 10 years all the way to above 50 years. The youngest case is 2 years, and the oldest case is 56 years old. And you can see that almost half, at least more than 45%, are younger than 20 years of age. And if we look at for the imported cases, let's look at where these cases have come from, and this table gives you a breakdown of the country of origin of travel of these imported cases. And we've had cases from Australia, which is topping the list now, United States, Philippines, Thailand, Canada, UK, Indonesia, Chile, and one lady who went on a cruise, so we're not quite certain exactly where to pinpoint that infection. So this accounts for the 118 imported cases that we have had. And this graph shows you the daily number of confirmed cases, a timeline of all these 142 cases. The bars in light blue or gray, are our imported cases. And the ones in purple and also hexed as well indicate our local cases. Okay? So the ones that are in bold purple are our local linked cases, and the one which are hexed are our local unlinked cases. I'll explain this further in our next slide. But what I wanted to highlight here was you can see that over the past few days we have had more local cases being reported. And now going into the 24 local cases, you can see that actually we can categorize these into 3 groups: community clusters, household clusters, and what we call unlinked cases. Okay, now I'm going to go looking at the community clusters. This accounts for 15 cases, which then can be further categorized into 4 distinct clusters. We have the River Life Church, which we have 7 cases, including 1 household transmission. So really 6 cases actually attended the event in the River Life Church, and 1 then passed it on to a household member. So we have a total of 7 ascribed to this cluster. Next, we have the Butter Factory cluster, accounting for 4 cases. These 4 cases were at this event at the Butter Factory. We have another workplace cluster where 2 colleagues, came down in the same workplace, and that accounts for 2 clusters. And we have another social cluster, which is, in a social setting, another 2 cases. These have all been reported earlier. So this accounts for 15 cases as ascribed to 4 separate clusters. Now we have another category of household clusters. This counts for further 4 cases. Now what are these household clusters? They're actually imported cases which have then transmitted to a household member. So here we have 4 cases. We had 1 from US. I think that's the one that we saw very early on. She passed it on to her aunt, and who was actually on home quarantine order, was actually receiving Tamiflu. And then we had a further Melbourne case. Somebody returning from Melbourne then passed it on to a family member. And we've had 2 recently with travel history to Bandung and Jakarta, who returned sick and then subsequently passed it on to another family member. So this accounts for 4 cases. Then we have a further 5 unlinked cases. These are solitary cases which we, as of now, have not been able to, they have not grown further into clusters. And the other thing I'd like to point out is that at one point, like today, an unlinked case, as we wait for more notifications to come in, we might be able to link them further. So with time, some of these unlinked cases will go on into like maybe community clusters. So the message that I want to put across now is really the source for the unlinked cases and the community clusters have not been identified. So for these 5 unlinked cases, plus for the 4 clusters. So actually, if you look at it in total, we have 9 incidents. In these 24 local clusters, we have 9 incidents which we have not yet identified the source of infection. So it's not as if there are like 24 with unlinked cases, but really, when you look at it closely, it's actually just 9 separate incidents that account for these cases.